In this role play session, we will be focusing on the initial session of CBT, where the focus will be on building trust, expressing empathy, and conveying to the patient that this is a safe, confidential space to express their feelings and proceed with treatment. What I will be doing is playing the role of a doctor, a psychotherapist, or a general practitioner, and Dr. Kimberly O'Keefe is Karen, the patient. And the way we will proceed through this role play is for me to ask Karen a number of questions, really probing that initial session, the initial aspects with regards to therapy. But as I said before, the aim is to build trust. And as we go through that conversation, we will highlight the important things to keep in mind through this initial interview. So let's get started. So in this role play, of course, you will be sitting down with the patient, but here we're going to be conversing with you and highlighting the important points. And of course, I'll be talking to the patient as well. So let's get started. Hi, Karen. My name is Dr. Sunil Rege, and I'm your therapist that will be helping you with some of the difficulties that you've been having. Now, Karen might be quite nervous or anxious, and sometimes patients are quite guarded and might not say much. Some of the helpful ways there is, of course, allowing some space, a little bit of silence at the start, or even stating that, Karen, I can see that you're quite anxious here, and it's absolutely okay to feel nervous the first time you're seeing someone new or even engaging in therapy.
I am feeling that way.
So here it becomes important to recognize the patient's mental states and provide some reassurance. So Karen, can you tell me what brings you here today?
Well, I'm not working at the moment and my mood's been really low lately.
I see. It must be quite difficult for you to feel the way you do. As we discussed last time, I'm here to help. And as you know, we'll be going through CBT.
Thank you. Yes, I remember. I've heard it can be really helpful.
Yes, it absolutely can. And CBT is an evidence-based strategy for the problems that we've identified in your case. What I'm doing here is starting off by instilling hope, which is a really, really important point of the overall psychotherapeutic process. So can you tell me a little bit more about what's been going on for you recently?
Well, I lost my job recently and I've just not been able to sleep. I feel like my thoughts are racing all the time.
So one of the important things that we've got to recognize now, of course, in this role play, we've identified that we're going ahead with CBT. However, let's say this was an initial appointment or you've had a few appointments, and when a patient talks about insomnia or racing thoughts, it's important that we rule out certain conditions that need biological treatments initially before they move on to psychological treatments. For example, if insomnia is significant or if racing thoughts are significant, the patient may not be able to engage in psychological therapy, may not be able to apply the homework, may get fatigued early. So it's important to provide relief if many of these symptoms are significant. Now, of course, with insomnia, CBT, insomnia can be put in place as well. However, as practitioners, it becomes very important to look at the overall formulation and also consider biological treatments should they be needed. So with that in mind, let's move forward. What I'm going to do here is I'm going to validate the difficulty that the patient's having, and that will help me build trust. I really appreciate you sharing that with me. It takes a lot to open up to someone else. So let's work together to identify some of those issues that stop you from moving forward.
Okay, I appreciate that. Thank you.
So the next step is one can move forward further with certain statements to continue instilling hope and building trust. For example, telling the patient that this is a safe space. For example, this is a safe place and everything you tell me is confidential, unless, of course, there are certain issues where I'm mandated by law to report. At this point, you can reiterate again by saying, I would like to reiterate that cognitive behavioral therapy is an evidence-based treatment and effective treatment for the issues that we've identified in your case. And by working together, we will be able to address some of those issues so you can move forward.
I'm really hoping so.
So essentially what we've done is we've instilled hope through statements, a single statement, or we've reinforced that particular statement. This helps build trust. We've ensured that we've communicated that the therapy is a safe space that allows the patient to build that awareness and also feel psychologically safe. And finally, before we end that initial session, I'll go ahead and ask saying, before we start, do you have any specific questions that you'd like to ask me?
No, I don't think so.
Great, so let's start exploring some of the issues in more detail. So to summarize this particular scenario, what's happened here is that the therapist establishes rapport by showing empathy, understanding, and creating a safe and supportive environment for the patient through reassurance. So by doing this, the therapist builds a strong therapeutic relationship with the patient, and it's also helpful to clarify any comments or statements and to reflect them back to the patient to show that you understand their exact meaning. It also shows that you're listening and you are interested in what's going on in their mind and in their life. So the reflection and validation guides therapy. And over time, if our assumptions are mainly accurate, it also helps to build that trust.